The Delta variant has quickly become the predominant strain here in the United States, much like other parts of the world. And I think as recently as last week, the CDC announced it represents about 83% of all new COVID cases. One of the concerns relative to Delta is there certainly seems to be some indication that it is more transmissible and can spread more rapidly. All the things that we have been doing for over a year and a half continue to work. Masking, distancing, hand hygiene, good ventilation. But the most important thing that we can do to prevent infections is to become fully vaccinated. The vaccines are incredibly effective at preventing the most serious complications of COVID-19, which is hospitalizations and deaths. They also are very good at preventing symptomatic disease in general. However, what we found with the Delta variant is we are seeing some more cases of people with symptomatic disease who have been fully vaccinated. The good news is they tend to be less severely ill, and very few of those individuals actually end up in the hospital. There aren't really good data to select one vaccine above another one relative to the Delta variant. The studies are ongoing. The good news is a full vaccination series, whether it's 2 doses of Moderna or Pfizer or even a single dose of the Johnson & Johnson vaccine, is still the best protection against severe illness. As long as the virus continues to circulate, there's always the possibility of new variants. Over time, viruses can develop mutations naturally, and some of those may select for advantages, which means they could become more transmissible or they could be more severe. And since this virus has been circulating worldwide for some time now, that's a lot of virus particles that have an opportunity to potentially mutate over time. So our best protection to minimize that or to ultimately eliminate that is to really focus on getting as many people vaccinated as possible. Probably a good idea to always evaluate the risks versus the benefits while the pandemic continues. And that could include travel, depending on the nature of your travel, whether you're traveling alone or in public transportation, what your destination might be, your ability to protect yourself even beyond vaccination in terms of wearing masks or distancing. And similarly so for other situations where you might find yourself in gatherings indoors. All those things you should probably consider along with your immunization status as to whether you need to either change those plans or find other ways to add to your layers of protection. Well, right now, the recommendation is to complete a full vaccine series with a single vaccine, whether it be 2 doses of Pfizer, or 2 doses of Moderna, or even a single dose of the J&J. There aren't a lot of data yet that indicate the additional protective benefits of mixing vaccines, although they are ongoing. There are studies comparing the efficacy of a combination of Pfizer and AstraZeneca, and some more recent ones that have included Moderna vaccine and one yet to be authorized in the U.S. called Novavax. So they're looking at combination vaccine studies right now. We know that children can carry the virus. Some of the studies that were done over the past year have indicated that children of younger ages tend to transmit the virus less than children of older age groups, teens, or even older toward the adult ages. So they can carry the virus. They can certainly transmit the virus, but the youngest children appear to be those less likely to transmit it than some of the older children. The American Academy of Pediatrics recently came out with a recommendation for in-person learning in schools, as well as that everyone who is eligible should get vaccinated. They've also added that they support a layered protective approach, which means that Anyone ages 2 years or older should also wear a mask, regardless of their vaccination status.